Hey guys, this is Dr. Mahajan from Mahajan Medical Center. Very excited with a new show today, and we have a wonderful guest today with us, Dr. Totah, a good friend, and has been a colleague helping me with tough neurological cases over many years. We share a lot of our patients at Modern Plant, where he has privileges, and we're going to talk about a very important topic for um, everyone who is in their, you know, fourth or fifth decade plus. Mostly we have a lot of geriatric population, and stroke is a serious disease or a condition where you get debilitated, and if not seek uh, urgent emergent help, it could cause lifelong handicap or disability. So we're very excited that we have expert like Dr. Toda among us to help us guide through how we can prevent this debilitating and extremely important condition, stroke. Um, a lot of you folks don't know, but 80% of the strokes are preventable, and we're going to touch on how we can do that. So without further ado, let me again introduce you to our practice, which is Mahajan Medical Center. We are at, as you know, in Largo, Florida. I'm into medicine. My wife is family practice, and we've been here 25 plus years serving our community. Here's a short intro to our practice. At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. All right, welcome back. Thank you for listening to the short intro about our practice. Here we go. Let's get Dr. Totah on our webcast. Abe, how are you?
Hello. Hello. Thank you for having me, and thank you for that kind introduction.
All right. So tell us a little bit more about yourself, how long you've been in Pinellas County, and where you got training.
Well, I graduated from USF, the neurology program. That's where I did my residency, and I've been in. After I graduated, I moved to Clearwater. I've been in Clearwater since. This is my 20th anniversary in the area, and I enjoyed every minute of it.
And you go to Modern Plant, correct? Your office is in Clearwater, correct?
I do. I do general neurology, so I see pretty much every neurological condition at some stage. But I do a lot of hospital work. I do inpatient neurology at Morton Plant. So I have a mix. I see patients in the hospital. They follow up in the office, and I get a lot of consults in the office as well that were never seen prior to that first visit in the office. So it's for me that works well. The combination of patients I see and the type of practice that I have between the private practice in the office and the hospital work that I do.
No, that's a very important field, and especially the topic we're going to talk today about stroke. Before we get there, what got you in neurology, Abe?
Well, in medical school, I had the good fortune to get exposed to top-notch neuroscientists and neurologists, and from there, I decided to get into neurology. That's where my residency came in at USF, and it was a great. USF is a great place for training. We have different hospitals, a private cancer hospital, the VA system, and basically a county hospital, Tampa General. And so the mix of patients was instrumental in getting a wide exposure to the field. And that's where we are today.
Yeah, neurology is a very exciting field with so much new treatments and new drugs available. For example, in the field of MS, that's exploding with new treatments every 6 months. You see a new treatment, and stroke, though,
Correct.
has been around for a long time, but with the clot retrieval treatment, which came in the horizon in the last 10 years or less, has been amazing in terms of adding to the. We'll go to the treatment option, but what I'm saying is a very exciting field to be in right now at neurology.
It is.
Yeah. All right, let's talk about the topic today. Let me bring the slides in here.
And just for disclosure, I'm not getting paid for this talk, and but I do accept tips and donations.
Yeah, no, me too. I don't get paid for this either. we just do it. Let me. I'm glad you brought it up, babe. We primarily started when the COVID started. We thought of this to be a fantastic medium for the community at large to get the direct information from the practicing physician instead of getting from social media or getting from the newspaper media. There is always some spin on it, but from practicing physician like you and me, we are in trenches every day. We get the best interest of our patient. That's how we started with it, and I do appreciate you giving your time and working for tips like me.
Yeah, certainly. Thank you for the opportunity.
All right, here we go. So the topic today is introduction to stroke and what can we do. So let's go to the next slide. All right, so what is stroke? So, on the screen, you can see that it's interruption of the blood flow to the brain, resulting in damage to the brain cells. So it's very simple. It's like heart attack in a way. And you will see a lot of commonality in the risk factors as well in strokes and heart attack. And it's very similar as you get a heart attack, as you know, with blood flow getting interrupted. Same way the brain blood flow get interrupted and you get damaged brain cells if it's been interrupted for long enough time and they don't recover. And that's what we're going to talk about. The time is the essence. Anything
Correct.
else you want to add to this definition there, Abe? I'm sorry. Go ahead.
Yeah, so I was going to add, interrupting the blood flow, the common factor there is that there's no oxygen to the brain cells. Now, without oxygen, the brain cells die, and that's what a stroke is. So it's brain cell death because of blood flow interruption. And there are two mechanisms. Go on.
So we'll go to the next slide. All right, so that tells you why we are bringing this topic for discussion today, why it's important. And Dr. Totah brought this slide with him, and it's very profound. If you look through it, every 40 seconds, someone has a stroke. Every 4 minutes, someone dies from stroke. And if you look at how many people get diagnosed with stroke, is almost 800,000 people, and 77% have the first time or newly diagnosed. And that's a good point that, the stroke could be mini stroke, and we'll talk about that in a minute. And that could be a ding dong bell that major stroke is coming. So you got to pay attention to your risk factors at the time if you God willing, get a mini stroke and get away without any damage. The last piece, what's up there, is very disturbing too. It's the third most common cause of death, and predominant reason is disability.
That's an error, Dr. Mahajan. The stroke used to be the third most common cause of death at one point, but it went down to the fourth most common cause of death until 2020. Then COVID last year, it went down to the fifth most common cause of death in the United States. After COVID displaced it for the number 4 spot. And the top three being heart disease, cancer, then unintentional injuries and accidents, and then COVID for 2020, then stroke. But worldwide, stroke is the second most common cause of death. So very, very heavy burden and very important condition.
To discuss. Yes, absolutely. And, I'm glad you brought Abe COVID into the mix. And as you've seen few cases, and I've seen few cases, COVID brings stroke to the picture too. There are thrombosis and blood clot formation with COVID, and it can block circulation to any artery. And, so the COVID itself can cause stroke as well.
It has been shown to be a cause. Yes, it's related.
And now with the, Johnson & Johnson vaccine, being put on pause with causing some clots in different circulation, including brain circulation in one of the patients, what I read. So, there is, unfortunately, everything is connected. Let's stay on the topic here. I know that you can go in any way.
Just another statistic, Dr. Mahajan. Last year in the United States, 160,000 people died of stroke. So we're in Largo. That's twice the population of Largo. Every year dies of stroke in the United States. And I just wanted to impress that number upon you.
Yeah, that's pretty profound. Yeah. Yes, so that's a, profound statement that twice the people in Largo, get strokes. So that's pretty. So what are the common signs and symptoms? What should people look out for? And we see people think of stroke being just the weakness on one side, and which is important to know, but it could manifest in other ways too. I saw a patient last month with severe headache, and she won't let me turn on the light in the exam room. And I got very worried because she has high blood pressure. So I sent her to the ED, and it turned out to be a stroke. And we'll talk about what kind of stroke she had. But yeah, so getting a severe headache, the worst headache of your life, and if the light bothers you, could be a stroke as well. So not just the typical classical presentation where your right side or left side of the face is drooping, and you're not able to walk because your legs are not moving or your arms are not moving. Those are important symptoms, but we forget sometimes it could be numbness, it could be headaches, could be trouble walking, dizziness, loss of balance, poor coordination. And then if it affects your eyes, then it can cause trouble seeing. And if it affects non-motor areas, it can cause confusion and memory loss and things like that too. You want to expand on that, Abe? You want to hit certain points here?
Absolutely. I mean, the take-home message is that any bodily change, functional change, is a potential stroke. The most recognizable signs are loss of speech, altered speech, the facial droop, paralysis or numbness, especially one side of the body, but also dizziness, sometimes unexplained dizziness, vertigo, even hearing loss sometimes, if it happens suddenly, it could be a stroke. So the take-home message is that if your body is not functioning normally, you notice a change in your loved one, that's a potential emergency. And your physician needs to be alerted, and even 911.
Why, Abe, this talk about the time is the essence. Can you elaborate on that a little bit?
Well, that's because of the medications and treatments that are available today. Since the late 1990s, we have medicines for acute stroke. So the patients who receive these medicines are at an advantage in terms of recovery. And that's why it's an emergency. And in addition to the medicine that I'm alluding to, which is referred to colloquially as the clot buster, TPA or Activase, we have other procedures that can be done in the hospital by specialists who can treat patients with strokes in the acute setting by catheters and going after the clot. I mean, they insert instruments into the arteries, and they pull out. They have the ability to pull out the clot from the brain. And for many patients, that's not only a life-saving procedure. Many of them are normal again.
Right. So, we'll get to the treatment options in a minute. I'm glad you brought it up. The time factor, that earlier you go, more the chance of the viability of the brain tissue, and you can save the tissue around the area of the brain which get directly hit, what we refer to as penumbra. So it's very important to understand that the time is the essence, like in a heart attack, with a stroke also, the time is the essence. If you go in a certain time frame, earlier the better. When you recognize your loved ones or yourself having symptoms, don't think it's a pinched nerve. It's better to look foolish that it's a pinched nerve than to miss a stroke. Let's talk about risk factors, so that will help people get tuned in. What if they have those risk factors? They should be more vigilant about the symptoms. Let's put that slide up. So, if you look at the population, Abe, and you see all that population in Pinellas County, which is tend to be on an older side, and you look through their medical history, and they have most of these conditions. Unfortunately, the hypertension, which, as you mentioned, is a silent killer, does not give you any symptom till you're too late into the game, and so it's very important to, anytime you're going by Publix, if you have family history of high blood pressure, or any other pharmacy or gym, get your pressure checked, or at least go to your primary care once a year at least, to get your full physical done, to check your sugars. And that's the next big killer. The diabetics get more strokes. So if you have family history of diabetes, or you're on a heavy side, you could be new onset diabetic too without the family history. So it's important to do once a year physical to catch if you have high blood pressure. As highlighted here is a silent killer, so you may not get any symptoms till you get a symptom of stroke, then it's too late. Same thing with the diabetes, unless it's super high, the sugars may not give you any symptoms. If it's super high, we call it polydipsia, polyuria, polyphagia, which means that you get excess appetite or excess urination and excess, sensation for thirst. But that we're talking when your numbers are super high, and you could have subtle type 2 diabetes and not know without checking your fasting sugars and A1C, and urine can give us a clue too. And then the age, as we just alluded to, that older you are, more the plaque buildup in your arteries, more the risk of the irregular heartbeat, what we call atrial fibrillation, is more prevalent, is the most common arrhythmia with the older age group. The next risk factor is diet and lifestyle. If you're living off McDonald's and Burger King and KFCs, then sign up for frequent flyer miles with Dr. Totah. He has that program for TIAs and stroke, buy one, get one free. So, more processed food you consume, more your risk is of, unfortunately, getting heart attacks and stroke. Again, we're bringing the same thing over and over again, and because the body does not differentiate which artery, whether it's your artery of the heart, artery of the brain, artery of the belly, artery of the leg, they all get disease from head to toe. So though we, go in our cells and talk about strokes and heart attacks separately, they're big fellowships and specialties, but end of the day, the risk factors are all same. Lifestyle, again, lack of mobility, lack of exercise, lack of motion is a big risk factor. Genetics, again, if you have someone in your family, early onset strokes or TIAs or heart attacks or poor circulation, you're high risk for strokes. Smoking, again, that's obvious, is very hard for people to quit, but it's one of the biggest thing. If you want to take home from today's talk, is improve your diet, walk more and not smoke, and you will reduce your risk of stroke and heart disease big time. And then we talk about heart disease, and the atrial fibrillation kicks in. So the atrial fibrillation is irregular heartbeat, and the blood does not move in your left atrium, and then it can throw a small clot to your brain because the blood is thick at the time, and that's a serious, common arrhythmia or irregular heartbeat of the heart. So if you're feeling that you're getting palpitations and irregular heartbeat, it's good to see your primary care or your cardiologist, get a EKG. And these days with the Apple Watch and the pulse oximeter, it's very easy to diagnose. You will see your pulse is like 78, 120, 80, 110. There is no pattern. That's atrial fibrillation unless proven otherwise. So you can really get a simple device like a pulse oximeter, which in COVID era is a good tool to have anyway, 30, 40 bucks. You can get it from any of your local pharmacies, and you don't need to get high-tech Apple Watch. And that can give you not only the oxygen level, which is nice, but also give you an indication for whether you have irregular heartbeat or atrial fibrillation. Last not the least, not as common in the older population, but more common in the younger population, but can happen at any age, is recreational drug use. Sorry I stole your limelight, Abe, but is there anything else?
You're good. You're doing an excellent job. You can keep going. But I'd like to add a couple of things. The risk factors mentioned, high blood pressure, diabetes, and so forth. These are primary risk factors. But I also want to emphasize that of the 800,000 people with strokes every year in the United States, 200,000 of those are recurrent strokes, patients that have had strokes in the past. So that's why that's a quarter. That's why it's very important, primary care and family medicine. It's very important for the patients, the stroke patients, to follow up with their doctors and treat their risk factors and make sure they're taking the medicines they're supposed to be on to prevent strokes.
That's a good point. Let's bring up the next slide, which is very self-evident, but there are three main.
This slide shows different types of strokes. And by the way, the slides are not mine. I borrowed them from different sources. They may be copyrighted, and that should have been a disclaimer as well. But that slide shows on the far left, a hemorrhage. That's a hemorrhagic stroke. So strokes are two types. It's either a clot that travels from anywhere between the heart and the brain. So it could be the heart, the carotid artery, other arteries in the brain, and it blocks that artery, that clot, and you have no blood flow to that part of the brain. As a result, the brain cells that are fed by that artery die, and that's what a stroke is. So a clot that travels from somewhere else is the first mechanism. And the other mechanism is atherosclerosis, which is hardening of the arteries, and that's the slide on the right. And there you can have a blockage that keeps growing to the point where the blood vessel closes, and that's another mechanism where the brain doesn't get enough blood. Now that artery could be in the neck, or it could be further up into the brain in any of the arteries of the brain. And then the hemorrhagic mechanism that we started off with is where the blood pressure ruptures. You get a bleed in the brain, and the blood in that circumstance doesn't go where it's supposed to. And it's the same end result, where the cells that are fed by that blood vessel, the artery, don't get enough oxygen, and they ultimately die if nothing is done. And one fascinating statistic about the number of brain cells that die when the blood vessel that feeds them gets blocked is, do I have that in a slide, Dr. Mahajan?
Sure.
It's 30, I think it's 30,000 nerve cells in a second.
Yes. Yeah, let me see if we have it in the slide.
And that works out to 2 million nerve cells a minute.
Yeah,
it's an amazing number. And the longer the artery stays blocked, the more cell damage and brain damage one will have. And that, again, goes back to the point that stroke is an emergency, and that's why the sooner you get treatment, the better off.
This just talks about the,
Yeah.
tissue damage, how, if you
This
cut
is just a more detailed
Right.
slide showing the actual artery in the brain. In the slide all the way to the left, the artery is blocked by a blood clot. And then to the right, it's a hemorrhage. The blood vessel, the artery ruptured, and you have blood in the brain.
Right, so let's look at the next slide and see if we... That's the CAT scan image. On the left, the
That's a
ischemic, where the
cross-section
artery is
of an
blocked.
ischemic stroke, right. On the slide on the left, the CAT scan shows in darker gray on the left, the triangle. That whole area is a stroke. That's actually it's the right side of the brain, but it's your left. So all the way to your left, the darker gray, that triangular area, that's in the right side of the brain for that particular patient. And that's all dying brain tissue, brain cells. And then the slide or the CAT scan, the cross section on the right, where you have the bright area in the middle of the brain, that's the hemorrhage. So just to give you a visual of what the CAT scan shows you in a stroke, different kinds of strokes.
The
And these
patient,
are very large strokes.
right.
But size may not matter. You can have a small stroke in a certain part of the brain that can be catastrophic, and you can have a relatively large stroke in another part of the brain that might be silent. But regardless, strokes are an emergency, and we just want to emphasize that point, that you should seek medical attention as soon as possible.
And the patient I was alluding to, Abe, with the light bothering her, and she won't let me turn on the light. That's subarachnoid hemorrhage. That's same hemorrhage, but a little bit.
Right, it's a variant of the hemorrhagic strokes.
Right. So there is different parts of the brain which we can get technical, but for this talk we don't need to. But so the different parts of the brain can get a bleed, and if you're on a blood thinner, and that's one thing we didn't mention. And a lot of people are on blood thinners for different reasons, whether they have blood clots in the lungs or in the legs, or they're taking the blood thinners for atrial fibrillation, preventing the strokes, can cause higher risk of hemorrhage, whether they fall or if they're getting old and frail and falling, or even without falling. If you take other drugs which interact with blood thinners, like NSAIDs and things like that, you got to be careful in older patients, as they can get more bleed in the brain.
That's a good point.
Yeah, so I think a lot of folks are taking these blood thinners now, and other blood thinners too. For example, Plavix, Brilinta, aspirin, post stenting and post procedures in the legs. So those also increase the risk because your platelets are not as effective in clotting. So yes, it's a double-edged sword in a way that you using these newer class of drugs like Xareltos and Pradaxas of the world, Eliquis, to prevent strokes, which are embolic strokes, or blood clots breaking loose from the heart going to the brain. But on the flip side, they can increase your hemorrhagic stroke risk, but not as much. You got to still be careful. You got to calculate carefully with the families. And
that's how it is in medicine. Most patients benefit from the treatments. Some unfortunate patients have complications, and they suffer serious side effects, unfortunately.
Yep. So, all right. So let's go to the next slide. Right. So this talks about the treatment options. We alluded to that earlier, the clot busting drug, which has been around for some time, and then the newer, fancier clot retrieval method. And the good news is the both Plan and recently HCA has been set up for the clot retrieval method because they are the stroke centers. You want to talk about that, Abe?
Yeah, for the designation of a stroke center, you have to meet certain criteria, and obviously, the most important is having the appropriate specialists. And for Morton Plant, it's met that designation for a while now, and we get patients from most of the county, from I think Almerton to Tarpon Avenue, and the patients are worked up as a stroke alert. I mean, everybody is prepared to receive these patients and begin the workup. And if they qualify for the Activase, a clot busting drug, they will receive that. And at the same time, the testing continues to see if they're candidates for the clot retrieval. And that's where the specialist pulls the clot from the brain. And if that's the case, that can take place in addition to the Activase, a clot busting drug. That's what's done every day at Morton Plant and many other hospitals, it's available.
It's amazing, how these new treatments, Abe, has improved, and how quickly the patient disability improves. And it's like a magic. You take out the blood clot from them, and with these different devices, and in expert hands, like we have intervention neurologists at Mont Plant, they do a fantastic job, and I've seen patients within few hours after
amazing recoveries.
Right, amazing recovery. So yes,
but again, the time is of the essence.
Right.
The one statistic that studies measure is the number needed to treat. For instance, with Activase, if the patient comes in within the first 90 minutes, there's at least a 25% chance of getting better. So that's 1 in 4 patients. If they wait until 3 to 4.5 hours, that number becomes 14. So about a 10%, 15% chance of improvement versus over 25% chance of improvement if someone comes in earlier. So even though the treatments can be effective later in the course of a stroke, they're much more effective very early on.
That's a great point. I think we need to keep hammering this point over and over again. This talk is time is the essence. So I appreciate you brought it up. The other thing which I've seen, the technology has helped with the stroke alert mechanism in the EDs is the virtual neurologist. That they have the availability 24/7 in the emergency department, and they can, see the images. They have access to the PACS system online, and then they look at the history, talk to the ED physician. So even if, most of the time you guys are there, but, let's say they need someone right away, the technology is amazing these days that you get such a quick answer, and whether you need a perfusion study or something or not, whether patient is a candidate.
It is a great resource, telemedicine, yes.
So I think that's one of the good impact of telemedicine. Other than, with COVID era, we saw the benefit of patients being at home and getting televisits with the primary care and the specialists. I think that was another great, movement forward. I think hopefully the CMS keeps it paid visit with telehealth moving forward. I think that's good for the older, frail folks who can't get transportation sometimes.
Yeah, we're keeping our fingers crossed.
All right, let's show them the fancy slide you brought. So there are different mechanisms of pulling the clot
Right.
out.
This is
And
the mechanical clot retrieval thrombectomy. And this image shows the logo's obscuring the right lower corner. That shows the femoral artery, which is the upper thigh. That's where they usually insert the catheter, and it gets pushed up to the brain. And to the left, you see the detail of the catheter. It looks like a spring. It's more like a stent. So that device entangles the clot, and then there's also suction. And that's how either the radiologist or the neurosurgeon or other specialists, that's how they pull the clot from the brain.
now that's a really amazing technology, and we are blessed that we have in our backyard, in a community hospital setting. So we are really thankful for all the advancements coming to our backyard. So now we're going to talk about, I think, what's another important take home is how can you prevent? And I alluded to that earlier, and I was pretty stuck with that number, Abe, that 80% of strokes and heart disease may be preventable.
It is
And
an amazing number.
yes, so let's break it down for our audience today. That if they do certain things, that will prevent it to get a stroke and heart attack. So if you look at the top piece, it talks about managing your blood pressure, your sugars, your cholesterol. Amazingly, sleeping 8 hours or whatever your restful sleep time is important. And we physicians are guilty of not getting that with the interruptions, so we die young. uh, Stop smoking and limit alcohol intake, and I think that's critical take-home message in any condition, whether it's heart health or brain health or preventing cancers. And our audience have gone through this over and over again in different talks, that it's so critical to reduce the amount of alcohol, which is a okay, socially acceptable substance, but has serious ramification on brain health. You get memory loss when people realize that alcohol is a serious neurotoxin.
Well, I know it's data against alcohol. Total abstinence is the latest recommendation, not only for heart health, brain health, also for cancer and many other ailments. The thing is, with alcohol, it's a social thing, and a lot of patients just can't give it up.
That's a good point. And moderation, everyone definition of moderation is also very different. Someone will say, oh, I'm just drinking beer. I said, okay, how many beers? 6 beers a day, that's it?
It's relative.
I said, okay, how old are you? I'm 75. I said, 6 beers a day, maybe when you're 25, maybe not that good either. But when you're 75, the liver can't even process it, So it's a thought process, acceptable thought process, something for every one of us to not do it, and not, less is good, as Dr. Totah just mentioned. Now, we can't emphasize eating better. We talked about, the body is a temple, and you need to give good offerings. If you don't give good offerings, you get shitty outcomes. It's a very technical term, shitty outcomes. If you look at the photograph below, anything which is plant-based, anything which you get from plant, you eat more, you'll never go wrong. Anything which comes when you have to wait in car lines and comes packaged in grocery stores will never have good outcomes. There's so many preservatives, there's so many fructose syrup, there's so many processed ingredient that you're setting your body up for failure. And by the time you get strokes or heart attack or poor circulation in your leg, you're backtracking at that point. So the key is to do it early on in your life, and it's never late. So even if you get a stroke, or a God forbid, a heart attack or mini stroke, if you change your lifestyle, it will reduce your future worsening of the outcomes or second or repeat stroke. You want to touch on that topic, Abe? That what's the difference between TIA or mini stroke and a stroke?
Well, TIA by definition is completely resolved symptoms. So TIA is like a stroke. It starts off with symptoms of stroke. And then these patients resolve on their own, or even with treatment. So there's no evidence of stroke in TIA patients. And these days, in the past, if clinically by exam you didn't show any signs of stroke, you called it TIA. But now with MRI, we know that some patients who look like they had TIAs based on their exams, they actually had strokes. That's the difference. And TIA is just as important as stroke because it's a warning, and that means that you need to talk to your family doctor, your PCP, and figure out why it happened and get treated. Actually, TIA is also a medical emergency, so it's in the patient's best interest to get worked up as soon as possible, and it's not wrong to go to the hospital for that. But the key is that the patient's back to normal, all the symptoms of stroke resolved, and that's a TIA.
And then, the other issue I think we need to highlight is if you have TIA and that's the body crying and telling you, get your act together, whether you're high blood pressure.
The warning.
It's a warning, yes, exactly. So get your act together, get your blood pressure down, get your sugars down, eat better, sleep better, and hopefully we can take a blood thinner if that's indicated, and get checked for cardiac arrhythmias like AFib. And a lot of time that's something hidden. People don't think about it, but it's good, important condition to check in those patients to make sure they don't have AFib or atrial fibrillation.
So I just want to comment a little bit on prevention. Prevention is probably a strong word in this context. It's really risk reduction. So the unfortunate truth is that you can do everything that's possible and you can still have a stroke. But the difference is that if you live a healthy lifestyle, you take your medicines, you follow your doctor's advice, you exercise, you may have a more mild stroke, and you are much more likely to be better off than the person who had a stroke who didn't follow a healthy lifestyle in terms of recovery, the potential for recovery, and your long-term prognosis. Again, the bottom line and the three pillars to health are a healthy diet, exercise, and sleep, in addition to following your doctor's recommendations, treating your medical conditions, and avoiding,
risk behavior, like we discussed, smoking
risky behavior,
alcohol. Yes. So,
drugs, and so forth.
Yeah, less risky behavior. Let's look at the rest of the pieces on prevention, which could be useful for the patients. Monitoring cognitive changes. So if you're having issues with memory loss, then it could be an indication for silent strokes. So it's good to get yourself checked. Maybe get a imaging done of your brain, like a CAT scan or MRI, to see if there is some subtle strokes, which sometimes does not give you full manifestations. Like we talked about earlier, like right or left-sided weakness. It could be subtle. So it's good to, if you're noticing that you're not remembering as well, then it could be a sign of silent stroke if you do have risk factors we talked to you earlier. And the easy part is get physically and socially active. I think both are important. So the physical part is obvious. If you can do 30-minute, as much as you can tolerate. If you can tolerate, brisk walk or something brisk, that's better. But at least do whatever you can do if you're arthritic as you're older, maybe doing chair exercises, which we have on our YouTube video with Jordan. That may be something to do. So whatever your capacity is, do it. If you can't walk as well, but you have access to a pool, just walking in the pool will take the gravity out. And the wonderful way of working out for senior population is pool exercises or water aerobics. So any of those things, I know with gyms being kind of closed, and now with more people having vaccination, still you got to be careful going to gym, but definitely do outdoor walking. And now the weather, we still have a spring weather here in Florida, so early morning. I think just going in nature and then going with a friend or family, as Dr. Totah brought up in his slide, being socially active. You want to comment, Abe, on the effect of the social connection and the mental well-being?
It's very important. Mental health. Studies show that to improve your cognitive condition, your memory, and your mental skills, you need activity, brain activity, and learning new skills is probably the best way to stimulate that brain in a positive way, and that takes learning new skills takes intellectual stimulation, strong intellectual stimulation, and it seems that communication, along with the intellectual stimulation, is important. So you need to find a new skill that's intellectually stimulating and that involves communication with others. And that seems to be the best way to maintain brain health. Now, it takes a lot of motivation, and it can be a challenge, but the studies point to the fact that that's what it takes. And an example of a skill that touches on all these factors is learning a new language. I mean, that's intellectually stimulating. You need to interact with people, and it challenges the brain, multiple areas of the brain. Another
brought a
music, learning an instrument. I mean, a very stimulating activity. But by far, I mean, the most stimulating activity, new skill that a patient, any individual can pick up is learning a new language.
Yeah, we had a fantastic patient on our show a few months back. She's in her late 90s and she still drives. She goes to East Coast to get her seafood with her friends. And I was very amazed at her vigor. And I asked her what's her secret, and she said, just hanging out with friends. I think
Right.
the COVID has put a damper on that part.
Yeah, there's a lot of social isolation around us, and very detrimental to the brain and brain health.
Right. And we talked in that particular webcast about the blue zones in the world, Abe, where anthropologists and scientists have studied, like in Costa Rica, Loma Linda, Sardinia, a certain part of Japan,
Right.
Okinawa.
Longevity.
Right. So they looked at longevity and brain health and heart health and quality of life metrics. And what you're pointing out here is what's panning out there as well is the common links, though, different cultures, but the common link is socialization, hanging out with friends, doing physical activity, eating locally, mostly plant-based, mostly local food, less processed food. All those things, what led to good brain health, less dementia, less stroke. So, what you're bringing is what I call neurobics, learning a new language. And the other piece which is prevalent and available in Pinellas County is dancing. I think
Right.
dancing is a fantastic social and physical exercise. If you enjoy it, A, you enjoy with friends, and B, you get physical activity, you get enjoyment, and you interact, you communicate, as you said. So,
Right. 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 So physical activity, mental activity, good nutrition, and good sleep.
right. So, yeah, so I'm glad you summarized that. Let's see if there's anything else you brought here. And losing weight. So, that's, pretty obvious, but a lot of time we don't think about it. It's harder, as we get older, the metab slows down, and, it's difficult to lose weight. So, paying attention to your optimal weight, and maybe, 10 years, 20 years back, what you could eat, get metabbed, and, you're more agile and active, and you could keep your weight down. Now, same amount of food, even you smell, gets on your belly and in your thighs. So you got to cut back your portions by 10%. Even by doing that, will have a positive impact on your brain health and your heart health, and reduce your other risk factors for other diseases like cancers, as well as obesity is directly linked with different cancers, the colorectal cancers, the breast cancer. So weight is definitely, adipose tissue is definitely a big elephant in the room. Um, I'm going to bring it to the end, pretty close to the end. Do you have any other pearls of wisdom other than what we discussed today for improving brain health and preventing strokes, Abe?
Well, again, the key for stroke is time is of the essence, and then the three pillars of good brain health, heart health, and really whole body health are good nutrition, exercise, and sleep, along with treating your medical conditions and following your doctor's recommendations. And lastly, I just want to thank my wife for improving the slides and making them look much better than they would have been under my direction alone.
I'm glad you gave that disclaimer, otherwise, you would not have got dinner today.
All right, good night, everybody.
All right, so we typically, if you want to participate, you can participate, Abe. We typically give a breathing exercise end of all my webinar, and today I got a square breathing for our audience. So if you want to do it with me, you can. If you don't want to, that's okay too. But I believe strongly.
Do you have time? Other questions or?
Oh yeah, I'm sorry. Let me bring the comment section up. Today we had Ray and Caroline watching. There's no active question, but if they post it, I'll pass it on to you. So,
Okay.
so we're gonna finish with square breathing. It does help the calm your brain down, to have those tools with you when you're anxious with COVID time. A lot of folks are going through different kinds of anxiety with the kids and with their loved ones, with their parents in nursing home, couldn't visit. So, different heightened level of anxiety, and the breathing exercises or pranayams help you calm those down. And square breathing is one of the ones which the Naval SEALs do it before their missions, and, very, very powerful tool. So it's very simple tool too. So there are four sides of a square. So with every square, where every side, so first side is inhalation, you count till four. The second side is hold the breath for count till four. And then the third part of the square is you exhale for count of four. And then you hold again for count of four. So that completes the square. So we're going to try 2 cycles of that to give that tool to our audience today. Um, okay, let's do that. So close your eyes, Abe. No cheating. And we're going to breathe in to a count of four. Hold for count of four. 1, 2, 3, 4. Breathe out through your nose for count of four. 1, 2, 3, 4. And then hold again for count of four. 1, 2, 3, 4. So that completes one cycle, nothing hard. But what I typically recommend for it to be effective is to uh, get a smartphone and or a timer and do it for 5 minutes. So do this cycle over and over again, the square breathing, uh, holding for a count of four for 5 minutes. So let's do three of these cycles without interrupting, and we can uh, use my count to breathe. So let's do the inhalation count of four, hold for count of four, exhale through your nose for count of four, hold for count of four, breathe in for count of four, hold for count of four, breathe out for count of four, hold for count of four, breathe in for count of four, hold for count of four, breathe out for count of four, hold for count of four. That's it. And it's a very simple tool, but very powerful tool. Thank you for doing that with Abe, and thank you for bringing all your knowledge,
My pleasure.
and
Thank you.
expertise. And all the good folks who are listening, Abe is a very talented neurologist, and he's taking new patients, correct?
I am.
Okay. So his practice is in Clearwater, and he sees everything related to brain and nerves. You do your nerve conduction studies in your office, correct?
I do.
Okay. And the EEG, you have referral, you go send it to the
We
diagnostic.
do EEGs in the office too.
Oh, you do EEG in the office too. Okay.
Hmm.
So that's one stop shop. They do the EEGs, nerve conduction studies, EMGs there. So that gets you a good expert diagnosis. You don't have to go to different places to if you have seizures, or if you had seizures, now you need to go back driving. So that's the neurologist to go to. Or if you're having memory issues, or God forbid you had a stroke, a mini stroke, you need someone to follow up. Dr. Totah is the guy. Thank you, Abe, for your
Thank
kindness, for
you.
coming, for tips.
Thank you. Thank you.
All right. You and your family has a safe spring and summer. Bye bye. All right, folks. So that brings us to the end of our show, and we're going to have another exciting show um, on our second Wednesday of May. So do tune in, and we'll let you know who the guest's going to be. With that, thank you for watching, and namaste.